Hi, this is AINeuroCare Stroke and Epilepsy Specialist. In the last talk, we talked about the businessman physician. Today, we're going to talk about the scientist physician. Now, being in the academics the whole time and being in the whole environment, this comes naturally. So I'm going to do some of these things a little shorter, but at the end of the day, I want to give you a different perspectives as well, because things are, again, changing because of both the technology factor, the pandemic factor, and, moving forward, things are changing in terms of grants, sponsorships, etc. So let's talk about it. So how do you choose that pathway? You can do basically a basic science research clinician, like full PhD, or not even a basic science. Like right now, a good friend of mine is doing bioengineering PhD while he's doing movement disorder specialist. So you can be a PhD and then become a proper scientist. You can become clinical sciences in terms of becoming a master's in science. And this could be different kinds of clinical sciences that you can go, or you can go through the public health route, which is doing a master's in public health. I generally do not recommend anymore going towards a public health pathway. I would recommend going towards the master's in science pathway more so than that, because there's a lot of different iterants, and we're going to come to administrator, MHA, master's in health administration, and master's in public health is becoming a field that is hard to distinguish per se. Again, the key issue is money. Duh. What the point is really is that where do you get the funding from? And there are multiple ways you can get the funding from. The biggest NGO is technically the government, right? The government is a large, organization that pays out grants and money, NHS, etc. And then you are competing for research funding at the government level, at the non-government organizations, and then there's private funding as well. There's a lot of private funding that goes into making sure that medical science is advanced, and in certain cases, medical education is advanced as well. Now, unfortunately, that's where the bigger issue in the healthcare system works in, because if you are working in a hospital health system and employed by an academic institute, and you're not on you're in a clinician's track pathway, or if you're in a faculty that does clinical activity, you have to pay a dean's tax. You basically, a part of your workload goes as a dean's tax into the School of Medicine. Even the whole hospitals, when they are in conjunction with an academic center, they have to pay a little bit amount to the medical school for basically getting those services, and then of course, more importantly, supporting clinical research and sometimes even basic research. And this has been causing a lot of problems. As a matter of fact, there has been recently some reports where medical schools were separated by the clinical institutes, and because the reason is that the hospitals' environments and systems are becoming extremely lean, and they figured out, well, why should I pay for it? And then now either they're asking to become stakeholders. So if, for example, they are supporting a study, they want future intellectual property, a percentage of that. But the whole system in itself is becoming uprooted, because the traditional dean's tax, even let's say I am not going to go into a clinical academic pathway, because why? What am I getting out of it? However, on the other hand, they're creating a massive amount of intellectual property that is sold for millions of dollars into pharma royalties. So this doesn't make any sense anymore to people, and especially now that we can tokenize, we can technically have a blockchain system in which my contribution can also be calculated. It is becoming a little bit harder and harder, and academic institutions are realizing, and they are changing their way. And then health system mission funds are there, but more importantly, some stakeholdership pathways are also coming in. Unfortunately, this is a tough game. Either you publish or you perish, because you have to do a high impact publication to get a grant. And if you don't get a grant, and then the grant is technically needed for a high impact publication. It is a churn that you are in. It's not something for me. I'm not going to tell you that, discourage you. But what I'm saying at the end of the day is, do talk to a person who's doing it. I'm not the one. But it is becoming an environment, is becoming more and more challenging. Why is that? I'm going to come to that in a minute. But people do forget that private practice is a goldmine for research. As a matter of fact, neurology, if you take the example, multiple sclerosis is one of those fields in which private neurologists are doing way better. And it's because that basically all the pharmaceutical companies is wanting that patient to have included in the research, and those medications are being sold at a very higher price. So therefore, you are getting a lot of research dollars going into private practice as well. And then you get fees for clinical trials, you get on advisory boards, you get speakership fees, consulting fees. There's a lot of it that goes into private practice research as well. And this is legitimate research as well. It's not like you're in bed with pharma company. There's a nice article that I'm going to put in the Academy website, is like, academics should not add insult to industry. Look, at the end of the day, if I have to choose my pathway from clinical research, there are two pathways, like one is basic science and one is clinical science. I really want to get directly in front of the human. And that's what industry comes best, right? I mean, they literally get to the patient. They're not talking about all the steps in front of that, which is important. Don't get me wrong. I'm not saying that's not important. I'm just saying where I sit in the whole pathway is where the end is. That's where I want to do the research. And that's literally where I fit in the most. And that's where you have to find out, where do your love lies, where do your passion lies, where do your purpose lies. And then you can design your spectrum, your avenue where you want to contribute as well. And again, it can change. You can do some clinical basic science research for a few years and turn into clinical research. And people have been doing that. As a matter of fact, that's sort of the pathway. Even the FDA heads that retire, they end up being where? In the advisory boards of pharmaceutical companies, because literally they have done their citizenship duty for years and years, and then they end up cashing it out on the other side as well. So there are ways, there's a spectrum. Find your passion, find your purpose. Now, technology is creating a new sort of wave of virtual clinical trials that are decentralized, that are global, that are cloud-based, they're wearables. And digital therapeutics is really, improving and getting better and better with each iteration of devices and softwares. And it is producing real good outcomes as well. Now, I will have a whole new series on virtual clinical trials. But again, you need to keep that in mind when choosing a subspecialty as well, because the whole clinical trials environment is changing because of the technology itself. Pandemic, unfortunately, had a very bad impact on research. As a matter of fact, if you look at the surveys, about 55% said that it had a very significant negative impact on their career trajectory, and then ended up having lower levels of productivity as well. There's overall, Europe had a 10% cut in research, and unfortunate, across the board, not just medicine, and it's huge, because clearly you need to support these research activities, and if you're not able to run the economy in the first place, how are you going to do research? So again, it is what it is, but at the end of the day, that environment to get back to full steam is going to take another 5 to 6 to even 10 years, because that funding doesn't just come back. So again, the already competitive environment is getting more and more competitive. Especially in cancer research as well. And I was part of the American Academy of Advocacy, and we were talking about provide research relief funding because of the COVID and support the RISE Act, etc. So again, things are a little harder, especially because of the pandemic. And but at the end of the day, choose your path, choose your passion, where you want to be in terms of clinical science and non-clinical science, basic science, etc., and then go from there. And next, we're going to talk about how to be an administrator. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.